It's had many names: muscular rheumatism, neurasthenia, fibrositis. Though it's probably been around for centuries, the first controlled study of this disease wasn't done until 1981, and the first proposed medications weren't published until 1986. That makes it a baby in terms of medical research and development. It's often mistaken for other forms of arthritis, like osteoarthritis, and some people within the medical community don't even consider it a real disease. So what is this mystery illness? Nowadays, its name means fiber muscle pain in English, but you'll know it by the Latin term fibromyalgia.
Fibromyalgia is a condition that's really pretty common, especially in a rheumatologist's office. It's associated with a lot of achiness, not just in the joints, which can happen, but really mostly in the muscle tissue between the joints. And what we find when we examine patients with fibromyalgia is that they have trigger points. They have specific areas that we call trigger points, sometimes around the shoulder, around the neck, in the anterior chest wall, in the elbows, in the knees, in the hips, all over. There are about 18 different trigger points that we check, and they're very tender, so that when we press them, you get ouch, ouch, and people kind of moving around. It's very tender, very painful.
A patient must feel pain in 11 of these trigger points for fibromyalgia to even be considered as the probable cause of their pain. There are no blood tests or objective screenings that diagnose fibromyalgia. It has to be a clinical diagnosis based on additional symptoms. We're not sure what the cause of this disease is, but there are theories. Nearly 90% of fibromyalgia patients have problems with sleep. In fact, there's an association with poor sleep and achiness in general. So it's thought that poor sleep leads to achiness, and then the two lead to the whole constellation of fibromyalgia symptoms, like fatigue, nerve pain, muscle spasm, and weakness.
Some people feel that depression might have something to do with it, but what came first, the chicken or the egg? Is it the fact that someone is so achy that they're really unable to do things and unable to function because they're so fatigued, and then they get depressed because they really don't feel like themselves? They used to do everything and be on the go all day, and then all of a sudden they just feel like they can't. So there's probably a link between depression and fibromyalgia, but exactly what came first is not clear.
Fibromyalgia is worsened by a variety of external causes, things like emotional distress, weather changes, and both strenuous activity and inactivity. It's like even the disease itself can't figure out what it is. So, to treat fibromyalgia, physicians often rely on the one symptom that most patients exhibit: the disrupted sleep cycle.
Fibromyalgia is treated with medications that actually improve the sleep cycle. So I start with a medication called amitriptyline. It's known as Elavil. And I use a very small dose because you don't need a very high dose of Elavil in order to correct the sleep cycle. And I would say maybe in about 30 to 40% of patients, it helps. There are now 2 medications that have been approved for fibromyalgia. For years, we had no medications approved for fibromyalgia. We were using medications like Elavil, muscle relaxants like Flexeril, cyclobenzaprine for fibromyalgia to give at night to correct the sleep cycle. And now we have 2 medications. We have something called Cymbalta, which happens to also be an antidepressant, but it's an antidepressant that helps with achiness in the body. And so it's really ideal for a fibromyalgia patient. And there's also another medication called Lyrica, which can be used for many different things, including peripheral neuropathy, but it also is now an approved medication for fibromyalgia. So for the first time ever, we now have 4 drugs that we can use for fibromyalgia.
Alternative treatments like massage, physical therapy, and light exercise have also been shown to be effective in decreasing fibromyalgia pain. On average, it takes about 5 years to diagnose fibromyalgia, thanks to its vague symptoms and unique manifestations in each individual patient. So if you're having muscle and joint pain, sleep problems, and treatment for things like osteoarthritis aren't currently working for you, you might want to ask your doctor to consider fibromyalgia. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.